So let's begin right now, Doctor, with the very basics, some screening guidelines that are important.
The recommendations in our community in southern New Hampshire is really for women to start beginning to have yearly mammography at the age of 40. That's for our average risk population, which is what the vast majority of our listening audience will fall into. So as a general rule, it's good for people to remember, starting at age 40, begin mammography and have it every year thereafter.
I understand that there's some new technology out there. I've heard a lot of women, friends of mine, that have gone for recent mammograms that had the 3D imaging.
Yes, 2013 has actually ushered in this new three-dimensional tomosynthesis mammography. It's now mainstream, and most of the major hospitals here in New Hampshire have it. It's wonderful technology that actually Dartmouth-Hitchcock was part of the studies that ultimately led to the FDA approval of this technology. From a patient's perspective, it's really a very similar experience to a traditional two-dimensional mammogram. But when we're able to read through the images, we are finding that a lot less people are being called back for additional imaging if they had this three-dimensional mammography. And also, it's allowing us to see through dense breast tissue.
Talk a little bit about the risk factors, because I know you talked basic screening guidelines age-wise, but let's dig a little more deeply into things that women should be aware of that might make them at a higher risk.
Sure. First of all, females get breast cancer much more than men. There's about 300,000 cases of breast cancer that will be diagnosed this year alone in women, and around 2,200 in men. So women far surpass men with breast cancer. Also, risk of breast cancer goes up with age. So an older woman is more likely to get it than a younger woman. Family history is very important. However, there's a major misconception out there in that the majority of breast cancers picked up day to day are in women who have no family history of breast cancer. I think that's important for the listening audience to know. I meet with women every day who really don't think that they're at such a risk for getting breast cancer because there's no family history. That's great. All that means is that if they had a family history, they'd be at a somewhat higher risk for getting it, but the majority of breast cancers out of that 300,000 diagnosed this year will be in average risk women who have no family history.
Tell me a little bit about, I know that there are fundraisers throughout the state, throughout the year. October is Breast Cancer Awareness Month. But some of the funds that are raised, what kinds of things do all of these fundraisers go towards? Is it specifically the study of breast cancer?
The study and the cure. First, you have to know how breast cancer functions. How does a cell that's otherwise normal become cancerous? And we have that pretty well down pat. We understand that pretty well. Now what we're moving toward is funding a lot of research for very specific treatments. Every breast imager, I think, longs for the day when there's a vaccine for breast cancer, when people can get inoculated for it and never have to worry about it anymore. And we're moving toward that, but that's a long ways away. So really, all we can hope for in the current time is to pick up breast cancers when they're small. And that's the goal, early detection of breast cancer. We can't prevent it as of right now, but if we can pick it up when it's tiny, a woman will really be ensured of almost successful cure.
How has all this awareness cut mortality, or has it yet?
Well, breast cancer is actually the number 2 cause of death in the U.S. The first is lung cancer. The second is breast. So it's really decreasing mortality. Again, the important thing is for a woman to go for screening mammography, because that's been shown to decrease ultimate death from breast cancer, which is important, and also to do a monthly breast self-exam, which I think should be emphasized for women. They should start in their 20s doing a monthly breast self-exam. If they notice something different, go seek health care. Go see the providers. Don't be alarmed. 80% of the stuff noticed on a breast self-exam will prove benign and not cancerous.
So many moms are so busy with their schedules, and we tend to worry about everyone else in the family. Talk a little bit about that, if you don't mind.
Sure. Very true. Women are very involved in family life, children, full-time careers, and aging parents. They're involved with everything, and I find so often women don't necessarily focus on themselves. And at this time of the year in October, really, it's a time for them to take a minute out of their day to schedule that mammogram appointment, do that breast self-exam, check in with themselves. If they're not taking care of themselves, they won't be healthy to take care of everybody else that's so important to them.
Very good information, helpful tips. Dr. Daniel Abbis, radiologist at Dartmouth-Hitchcock in Nashua. Breast Cancer Awareness Month. We're glad that you could fill us in, Doctor. Thank you.
Thank you. I hope you have a wonderful day.